Hello everyone, I am Dr. Mehta from Shri IVF Clinic in Mumbai, and today I am here to clear the misconceptions and the unreasonable statements which people pass about IVF or in vitro fertilization. Remember, लोगों का काम है कहना, but लोगों के कहने से या लोगों के ना कहने से आप pregnant नहीं होने वाले. It's very important that as a couple you understand the important things regarding this treatment and then make an informed decision so that you get the desired result and the desired happiness which you've been long waiting for. The most important thing to understand before understanding the stages of IVF and ICSI is that in either of these techniques for assisted reproduction, the factor that is of paramount importance is doing a good patient selection. After the patients have been well selected, the stages of IVF and ICSI can be explained as follows. The first stage for any procedure for assisted reproduction is assessment of the ovaries and performing ovarian stimulation, or rather performing controlled ovarian stimulation. And these days we are moving to performing individualized controlled ovarian stimulation. Following the ovarian stimulation, these eggs need to be picked up. That means the eggs need to be taken out of the body for further processing. This is the second stage. The third stage is a technical aspect, which is either performing IVF or performing ICSI or performing any other additional procedures which would be an adjunct to embryo development. And the embryo development, which occurs after fertilization, is the fourth stage. Following the embryo development, it is absolutely vital to monitor the growth patterns of a particular embryo, which helps in embryo selection. And remember, one always gets a good result on a well-selected patient when a well-selected embryo is put inside the uterus of the intended mother. That means embryo selection is the fifth stage and a very important but a critical stage. Following the process or during the process of embryo transfer, wherein the embryo is put inside the intended mother, there are certain additional steps which may or may not be followed. And one of the most important steps which may be recommended to you at this stage is the process of freezing, which is commonly called in medical terms as vitrification. This is a critical stage in embryo development wherein the embryos or additional embryos can be preserved and can be used for your treatment in the subsequent cycles or in order to have subsequent pregnancies. And the most important stage, which is the support of this entire system, is called as the luteal phase support, which is the next and the last stage. It is very important to note that since this entire technique is being performed artificially and since we are bypassing nature, in order to stimulate conditions which are as similar to nature as possible, the doctor will recommend luteal phase support in varying degrees and contexts based on your uterine parameters and based on your age. We commonly get couples who come forward for doing treatments for assisted reproduction these days, and one of the things which is always hurting them somewhere emotionally or in their mind is probably a misnomer or a misconception that if I do IVF, is this child going to be my own genetic child? Well, that's absolutely normal for a couple to have this anxiety over this statement. But it's important to note that a good IVF clinic and a good IVF consultant is always going to take your signatures and is always going to assure you that the genetic material, that means the female partner as well as the male partner who are going to be the intended parents, are going to have an equal contribution in the development of the baby. However, again, it's very important to note that in assisted reproduction, there are procedures which involve third-party reproduction. Whenever your consultant is speaking to you about third-party reproduction, it would involve either taking a sperm donor or taking an oocyte donor or taking a uterine donor. Now, uterine donor is commonly called as a surrogate, as how we commonly know. But the third party reproduction is also a highly monitored procedure, and your clinician is definitely going to take your signatures prior to performing any assistive step in third party reproduction. So that is one thing which I would really want the couples to be assured about, that as long as they are choosing their clinic wisely and they are choosing their clinician wisely, they should always be assured that if they want to have a child with their own genetic material, then it's always going to be happening that way only. So if you were to listen to one advice or one strong point which I would like to convey to all couples who are planning to undergo assisted reproduction, is one thing. Remember, unfortunately in this treatment, a doctor is trying to compete against nature, and in this procedure it may or may not be certain that you might end up with a successful pregnancy, because broadly speaking, despite the best efforts which humans are trying to put inside this treatment, the average success rate of this treatment over a broad age group remains to be approximately 30 to 40%. And that's why it's very important for a couple to be mentally prepared. It's unfortunately not like doing a digital marketing or a digital shopping where you may pay 1 lakh rupees and you will get something that you really wanted. Here, you might pay 1 lakh rupees, you might do the entire procedure on your body, and at the end of it, you might not get what you wanted. And in such situations, it is very, very important for the couples to carry forward this treatment without losing any hope, because at the end of this treatment, it could be 1 attempt, it could be 2 attempts, it could be 3 attempts, or probably even more based on your particular complications. This is one of the best scientifically proven treatment which has stood the test of time again and again and again.